in ulcer patients, some patients they gain the weight and some patients lose the weight. Now, what is the difference and what makes the difference? Very simple. So first of all, ulcer patients, those who are having or feeling pain in the stomach, so we actually classify them into two categories. Some have pain right in the stomach. We call those patients having gastric ulcer, and some have pain in the very first part of the small intestine, that is called as duodenum. So we put them in the category of duodenal patient having ulcer. Which one? Duodenal ulcer. So if a patient is having ulcer or problem here right in the stomach, that will be called as gastric ulcer patient. And a patient who is having the ulcer or the problem just right after the stomach, the very starting of the small intestine. So if there is a problem, then we call that patient as a patient having duodenal ulcer. Now come towards the point, that is the gain and loss of the weight. So if a patient is taking food and the food relieves the pain, meaning the pain is subsided or the pains are kind of lost for a while because of eating, so that patient is actually having the problem with this very first part of small intestine. So we can call this patient as a patient having duodenal ulcer. So a patient of the duodenal ulcer increase weight or may gain the weight. So a patient having duodenal ulcer, the weight is increased in the patient, and a patient having gastric ulcer, the weight is decreased. Why? Because these patients, when they eat, they feel pain, because of which they may decrease eating habits, and because of which the weight loss is observed in the gastric ulcer patients. So, well, this was the discussion regarding the gastric ulcer and duodenal ulcer and the patients with respect to their weight. So, who are gaining the weight and who are losing the weight? Duodenal ulcer patients gain the weight, and gastric ulcer patients lose the weight. And this was actually a little bit understanding from my side, and I hope so you got. If you still have any confusion anywhere, you can drop that in the comment box. And thank you for watching Dr. UT Lectures.